treating diabetes. Hospital/Columbia University Medical Center are testing new therapy to enhance blood glucose levels and manage a significant consequence of diabetes using weight loss surgical procedures. A university hospital may be the first to use the sleeve gastrectomy weight loss surgery technique to treat gastroparesis, a diabetes-related disease in which the stomach's contents are unable to empty into the intestines. Due to their inability to transport food efficiently through their digestive system, patients with gastroparesis may experience symptoms such as discomfort, nausea, vomiting, abdominal bloating, and malnutrition. Treatment options include medical medication, dietary changes, and the implantation of a gastric electrical stimulator, or gastric pacemaker, a device that helps manage nausea and vomiting. When 4 patients with gastroparesis were denied gastric pacemakers, surgeons at New York Presbyterian/Columbia performed a sleeve gastrectomy to see if it could help. We don't understand why this is the case. A sleeve gastrectomy may reset the natural gastric pacemaker, or the smaller stomach may increase intragastric pressure, allowing for faster gastric emptying. Used a sleeve gastrectomy to treat gastroparesis. Metabolic and weight loss surgery is developing a program that will cover all gastroparesis treatments, including gastric pacemakers and sleeve gastrectomy. Surgeons at the Center for Metabolic and Weight Loss Surgery are performing weight loss surgery for the treatment of type 2 diabetes as part of an ongoing clinical trial. According to their findings, gastric bypass surgery is a safe and effective way to manage diabetes by lowering the risk of diabetes-related death and improving blood glucose levels, reducing or even eliminating the need for medication.
Thank you for watching. Hope you will like the video I created for you. Please support me, click on subscribe. Then click on the bell. Please tap the below to view videos of the same series.